Yeah. Good evening, everyone. My name is Simran Chaudhary, and on behalf of Voice of Healthcare, I warmly welcome you all to the panel discussion Embracing Pink Beyond Ribbon, Breast Cancer Awareness, organized by Voice of Healthcare and supported by Pfizer. As we all are gathered here on the Breast Cancer Awareness Month, this event serves as more than just a symbol. It is a commitment to enhancing our understanding of breast cancer and taking actionable steps towards greater awareness and empowerment. Today, we'll delve into the latest breakthroughs in research and treatment, highlighting the critical role of early detection. Beyond the science, we'll explore the emotional, social, and physical challenges faced by the patients and the survivors, fostering a conversation that aims to inspire, support, hope, and resilience in our communities. And we are honored to have a panel of esteemed experts who will shed light on the key facets of breast cancer care and awareness. Together, we aim not only to inform but inspire change in how we approach this journey, both individually and collectively. I would like to start by introducing all the speakers for today's panel discussion, starting with Dr. Adil Hassan, a consultant medical oncologist at Apollo Excelcare Hospital, Guwahati. Welcome to our show, Dr. Adil Hassan.
Thanks a lot, madam. Pleasure to be here.
Thank you so much, sir. Dr. K. Chandralekha, medical oncologist and radiologist at VS Hospital, Chennai. Welcome to our show, ma'am. Thank you so much, ma'am. Dr. Mridul Malhotra, senior consultant and unit head, medical oncology at oncologist at Manipal Hospital, Dwarka, Delhi. Welcome to our show, Dr. Mridul.
Thank you. Thank you so much for this opportunity.
Thank you so much, sir. Dr. Shruti Arora, medical oncologist and hemato-oncologist at Nanavati Max Hospital, Mumbai. Welcome to our show, Dr. Shruti.
Yes, thank you. Thank you for having me.
Thank you so much, ma'am. Dr. Arun R. Warrier, senior consultant, medical oncologist at Aster Hospital, Kochi. Welcome to our show, Dr. Arun.
Good evening. Great to be here.
Thank you so much, sir. For today's panel discussion, I would like to start the conversation with understanding breast cancer and creating general awareness around it. I would like to start this conversation with Dr. Mridul. So, to start with basics, what exactly is breast cancer and how does it develop in the body?
Yes, thank you for this question. So, as you said, it is a very basic question. So, basically, what is cancer? Cancer is basically uncontrolled proliferation of a cell which does not have any inhibition. There are certain factors that inhibit the growth of the cell that is not there, and then over a period of time, it acquires certain characteristics like self proliferation, and then it acquires angiogenesis, neoangiogenesis, which is the formation of its own blood vessels, and basically it is uncontrolled. So this cycle that which happens in one particular cell, later this one cell becomes two cells, two become four. So that way they keep on multiplying, and eventually it forms a cancer. So if it happens in any particular tissue, let's say now it happens in the breast, so we call it a breast cancer. But the basic thing to understand is that it is like the misbehaving cell that does not basically obeys the uh, basic principles of the body, that a particular cell has to divide, and after that it has to stop dividing, and then it has to die. So it does not die, it does not undergo something called automatic cell death or apoptosis. And all these properties, after acquiring, it becomes a cancerous cell. And if it happens in the breast, it is called a breast cancer.
Thank you so much, Dr. Mridul, for explaining us in a very simple language so that all our audience can understand the concept or to understand what exactly is breast cancer and how it develops in our body. Moving on to my next question with Dr. Adil Hassan. So, why is breast cancer awareness so critical? Since we all have gathered here to speak about, to create awareness about breast cancer, especially with the rising number of cases globally nowadays. We see.
Yeah, I think that's a really important question. See, nowadays, I would say in the last 2 or 3 decades, we have seen in general the number of cancer cases are increasing, and more so in our country. In fact, breast cancer is probably the most common cause of cancer in women in our country, and almost close to, as per the last statistics that I know, probably close to 1.5 to 2 lakh women have been diagnosed with breast cancer every year. Okay? And also, because the mortality because of breast cancer is probably the highest in our country when compared to any other country. So we understand, in our country, the cases are coming at a little bit a later stage when compared to the West. That's probably because, they're more awareness and they're more aware that they need to get screened and they need to detect the cancer at an early stage. So I believe forums like these are very important to make sure, our audience is educated or everybody knows, what are the signs, symptoms of breast cancer so that we can try to catch it early. Because for a large number of patients, especially the early stage cancers, we can definitely cure them also, right, with the disease. So I think that's pretty much the reason why all of us are here, and I really appreciate all of you for bringing up this topic and making us a part of it.
Thank you so much, Dr. Hassan, for explaining us that and creating that importance and raising that voice around awareness. So that means a lot.
Yes.
Moving on to my next question to Dr. Chandralekha. Ma'am, what are some common misconceptions about breast cancer that often prevent early diagnosis? Like Dr. Hassan also said, most of the cases they see is almost of the last stages. So why is this happening and the common misconceptions which is, giving kick to all those things?
Yeah. So good evening, everyone. Thank you for this opportunity. And yeah, it's a really needed question. And apart from the lack of awareness, the major misconception is that most of the women think it would be a ordinary lump or something. They don't think it has a it can be anything which can turn cancerous. So the primary thing which is lacking is the awareness. So usually they neglect it and they think it's an ordinary or a fat globule or whatever. And some pregnant patients who are elected to have cancer, they also think it is a collection of some milk or whatever happened post pregnancy. One thing. The second thing is that once they come to the doctor also, and if they are advised a simple biopsy test, many people think that just poking with the needle would cause spreading of the disease. Or if they are advised a surgery, for example, there are people who think that doing a surgery or cutting the tissue from their body spread the disease as well. So I think these two.
Thank you so much, ma'am, for actually putting light on the major misconception. Like people always ignore their health, and they feel like this is just a normal milk lump or something like that. But yes, that's what we all have gathered here to address those issues and to create that awareness. Moving on to Dr. Shruti, ma'am, how can individuals better understand their risk factors and what should everyone know about the importance of self examination before going to the doctor?
So I think so. Awareness is a very important part of stepping into it. And it is a combination of being alert of your own personal history, your own family history, then even understanding what are the risk factors for breast cancer, and which one among those is modifiable, which ones we have control on, and which we cannot do anything about. Like among the risk factors, female gender, age, a family history is something which we do not have control over, but things that we can modify in terms of our health, in terms of a good lifestyle, being physically active, and eating well, exercising, avoiding alcohol, smoking, all of these things. And it is very important to do self breast examination. So females, especially in India, are very shy, to watch themselves also in the mirror, let alone going to a doctor for a clinical examination, which is highly recommended at least once in a year. And all guidelines across countries recommend doing screening mammographies after the age of 40. So I think so it should initially start with a self breast examination, where all females examine themselves at least once a month, and understand their body so they can pick up changes with early. To add to that, they should go to a doctor at least once a year to get themselves screened, and after the age of 40, get mammography screenings done, because breast cancer is something that we can early detect, and which has wonderful outcomes if detected early.
You said it right, ma'am. Because of the medical advancements and the innovations we have, it is nowadays easy to detect. And if diagnosed at an early stage, the treatments are also, I believe, a short period of treatments are there, or could be easily treated as compared to if diagnosed at a later stage. Thank you for
Absolutely,
bringing.
absolutely, yeah.
Thank you so much, ma'am. Moving on to Dr. Arun with my next question. So, what are the key symptoms or signs of breast cancer that people should be vigilant about, and when should they seek medical advice?
I think the Dr. Shruti started the same thing, because if any change which happens in the breast, any swelling or any discharge from the nipple, sometimes it may be some swellings in the armpits. They can be the sign of breast cancer, which is say the localized to the breast. The thing here is that many of the females will have small lumps in the breast, which may be coming and going with the period, something we call as fibrocystic disease. So nowadays we are seeing a lot of people, because I think over anxiety is also there. So with the small lumps also they come for an advice, and many people want to biopsy them. So that is also we have to caution them against that. So any lump in the breast, you need not jump, and it's not like breast cancer is spreading an epidemic nowadays. So there are lumps in the breast which are because of the hormonal changes. It can happen there, and it is quite normal. So we can do an imaging and then reassure them that there is nothing to worry, and only if some it is increasing in size or thing, you should seek advice. And I think one of the problems is that they feel there is no pain, so this may not be cancer. So that is also not correct. So particularly once the periods are over and again some swellings are coming up, then also they should seek advice. So I think it is to be awareness is the key thing here. Each female, like Dr. Shruti told, should do clinical self-examination and be aware of the texture and small lumps which they have. And if anything new is coming up, they should seek advice. That's the main thing.
Thanks a lot, Dr. Arun, for explaining us that, and creating that awareness around the symptoms, so that people are more vigilant about when should they seek medical advice, and when should, or importance of early, in case they feel like something is there, they should go for the checkup and get it tension free that okay, nothing is there, the results came out, it is good, and they are fine. Moving on to early detection and screening, Dr. Mridul, how important is early detection in improving breast cancer outcomes? And what are the most effective screening methods available today? Dr. Mridul, can you
Sorry,
hear
just
me?
come again. I couldn't get the
Sure,
question.
sure. So I just want to know how important is early detection in improving breast cancer outcomes? And what are the most effective screening methods available today?
I think there is some network problem, the speed problem. I am not getting the question.
Is it from my end? Am I audible to everyone?
Yeah, you are audible. Now
Yes,
you're audible.
yes.
So, sir, shall I repeat my question to you?
Just tell-
So, this is regarding how important is early detection in improving breast cancer outcomes, and what are the most effective screening methods available today?
Okay. Okay. Right. So, yes, it is absolutely important. Breast is a superficial organ. To detect if there is any lump that develops in the breast. Detect the breast is monthly aware. They should know how their breast feel. Breast examination after the age of 20. And after
Dr.
the
Mridul,
examination by a specialized person.
your
Yeah,
voice is breaking a lot. It's very difficult to understand what exactly are you trying to explain us. Uh, is there any other way you can
I
connect
think.
from your mobile or something?
Okay, I think you can go ahead. Let me just check the connection. You can
Sure. Sure. I would like to
continue
take
the show.
this
Let me check
question.
the connection, internet connection.
Sure, sir. I would like to take this question, Dr. Arun. So, if you can answer this, how important is early detection in improving breast cancer outcomes, and what are the most effective screening methods that is available today nowadays?
I think early detection is very important because we can detect even in situ cancers, that is, even before they're invasive. So, actually, the mammogram picks up many of these non invasive cancers. So, it requires just a removal of that area. That's all. Sometimes even radiation may not be needed. So, almost everyone is cured by this when we are picking up these in situ cancers. Otherwise, also, we have mammograms, which are quite well after the age of 45 we can easily do that, and it has to be repeated once in every 2 years. Again, one more issue is the number of new breast cancers in the young patients nowadays. So in them these mammograms are not very sensitive, so we may have, if there is a strong family history and if the suspicion is high, we may have to go for tests like MRI, but then it is not to be done for everyone. Only in selected cases we can go for MRI and all. So basically, for population wise, it is the self and clinical examination followed by MRI after the age of 45. That is what applies for the general population.
Thank you so much, Dr. Arun, for sharing us about the latest advancement for screening or screening methods of the breast cancer. Moving on to Dr. Adil with my next question. At what age or stage in life should women begin regular screenings like mammograms, and how do screening guidelines differ based on the personal risk factors?
Madam, usually the guidelines they tell us that the screening, because the breast cancer is more after the fourth decade of life, that is after 40s, 50s, and 60s. This is when you see breast cancer in a majority of the ladies. So the guidelines tell, or most guidelines say in the West at least, it should be more than 40 years of age. It has to be done in the form of a mammography. It has to be done once a year. And some guidelines also say probably after the age of 45, you'll have to do it once a year. So for ladies who are younger than 40 years, in case if you want to screen, there's two types of modalities in which we generally use. One is an ultrasound of the breast, and one is an MRI of the breast. So as far as the personal risk, the second part of the question that you asked, suppose if there's a very, very strong family history, say if a lady is having a cancer and other members of the family like their aunts and mother, sister, multiple members of the family are affected with breast cancer, and you're thinking there's a possibility of hereditary risk for breast cancer, probably you can start the screening much earlier, as early as probably 30 years of age. But in this particular population, there are some guidelines for that also, depending on whether something called this genetic test, if it comes positive, then the guidelines are a little bit different. But for in general, what I would like to say is we do screening once after 40 years, once a year, and for less than 40 years, we do something called ultrasound of the breast, and in some select cases, we do MRI.
Thank you so much, Dr. Adil, for explaining us that. Moving on to Dr. Chandralekha, ma'am, my next question to you is, what role does breast density play in detection of breast cancer? and how it impact the accuracy of mammograms?
Sorry?
I asked ma'am, what role does breast density play in breast cancer detection, and how it can impact the accuracy of mammograms?
So, in younger individuals, obviously the breast density will be more. So the detection of any lump clinically will be very difficult for those individuals. Either doing a self breast examination or even for some clinicians also, if the density of the breast is more, that will be a hindrance in detection of any smaller lump. So, and one more thing is that there is chance of increased risk of cancer for those for people who have increased breast density. So the increase, it is one of the etiological factors also, risk factors for predilection of breast cancer. And coming to the diagnosis, it can be combined with an ultrasound and an X-ray mammogram so that the detection of the mass can be made easier.
Thank you, ma'am, for explaining us that. Moving on to my next question, Dr. Shruti. Ma'am, how can healthcare system and communities work together to make screening more accessible, especially if we talk about in rural areas or the underdeveloped areas where the awareness is less? Because
So
we,
I think this is a very important topic that you've touched upon, because see, we do have a lot of awareness happening in the urban, but in rural areas where we just have primary healthcare, I think so. What is important is first creating an awareness in these areas. I have seen, worked in these places, and we known that that's very busy. So taking opportunities like the October month or Women's Day is a chance where we can, create awareness on those platforms in the communities. And I think so, having at least self-examination posters and mammographies should be a part of the routine health checkups when a woman of 40 years walks in. Considering the load that we have in our rural population, targeting, like Women's Day, like 8th March, and all can actually be a good chance where, generally you can have some skits, play some things where they learn about how important it is, and how important it is to be comfortable with your own body, how important it is to be comfortable by tell your own husband or your children, about any smallest lump that comes. So I think so talking more about it by our relatives, at the primary health centers, and would really help to bring out a lot more numbers which really come late to us. Because for now we've seen that urban population is reaching us early at the clinics, but the rural still comes with, massive large disease because of the stigma around it. So I think so talking more about it, having such programs, really matters.
I think you pointed out very right thing, ma'am. There's this hesitancy, or people not talk much about it. That's why I think it gets detected very late, and it comes in mind. Okay, we'll go to it if there's some problem arises, then only. So I think that's what we want to create awareness about early screening, not to focus more on treating patient, but to focus more on as much as screening we can do, so that if there's cancer, it can be cured at an early stage rather than going to a later stage. But as we all discussed about the screening methods and early detection, we'll move forward with prevention and risk factors, starting with Dr. Arun. So, what are some of the most significant lifestyle factors that can increase the risk of developing breast cancer?
So what the study says that almost approximately the 40 to 50 percentage of breast cancer risk factors are modifiable. Like we saw in the beginning, there are something like family history, female gender, we can't do anything. But then, like if having a healthy lifestyle to reduce the consumption of fatty food, to maintain a healthy body weight, to exercise regularly, to avoid smoking, and to limit the intake of alcohol. All these are things which everyone can do. And again, cancer is not, we can't tell this causes cancer. So it is a multifactor. It is just like driving in a car. So if you apply all the safety precautions, then the chance of an accident is very less. So that is why each of these things are important. But then again, people come and ask us whether this special diet will help us, whether then there is no science behind that, whether we should take some medications like antioxidants, vitamins, all are freely available in the market, and a lot of hype is built around that. But then what we know, understand is that scientifically, these things have not been shown to reduce the risk of cancer. So you need not take all these supplements and all these things, but do the things like a healthy lifestyle as before. So that will definitely help. And one other thing is that many, I don't know whether how much it is modifiable, because of various reasons, people are postponing the families, like the childbirth to the 30 plus years and all. So that some studies tell that it can also have an impact. So because of the that postponement and how it alters with the interplay with the hormone things and all, that may also increase the risk of breast cancer. But that is again a very gray area, so we can't tell that. But definitely having a leading healthy lifestyle is of paramount importance.
Thank you so much, Dr. Arun, for as we all are here to promote a healthy lifestyle so that we can avoid any kind of disease, be it breast cancer or any other type of disease that occurs due to lifestyle factors, whether mostly the modifiable risk factors that can be avoided. So yes, focusing more on a better and a healthy lifestyle. Moving on to my next question with Dr. Mridul. So, can breast cancer be prevented entirely? And if not, how can individual lower their risk through lifestyle choices that is diet and exercise? And why this question is again asked or emphasized more on this is we want to increase awareness on healthy lifestyle that normally people are not living nowadays. Dr. Mridul?
Yes,
Yes,
I'm
sir.
audible now.
Yes, sir, you're audible.
Yeah, sure. So, see, basically, there are certain factors that are leading to breast cancer, right? Which is there is exposure to the hormones, whether they are intrinsic hormones or whether they are taken from outside, right? So these are major factors. But besides that, diet may be there, obesity is a factor, smoking is a factor. To some extent, alcohol is also considered not to be safe. And alcohol, so smoking in combination, they are always synergistic. That is, they have more than just additive effect. So all these factors, like intrinsic or excess of hormone exposure happens because of the early menarche, late menopause, and then if they are taking some hormones in the form of hormone replacement therapy, which is less now. But again, I have seen now people who are getting exposed to the ovarian stimulation for infertility, and seeing more and more such patients who are also getting cancer in those subgroup. So all these factors are one side. But having said that, even besides that, the person can acquire breast cancer. So ultimately, what one can do, that the main point is what one person can do. So whatever that is good for your heart is good for your breast. So you have to maintain a healthy lifestyle. You have to be physically active. You should not be obese, should not be overweight. You should do at least moderate exercise that challenges your body, that reduces the fat content of the body. For heart, we say 150 minutes a week of the moderate exercise. So all these are the cumulative factors, the healthy lifestyle factors, the choice of food, which is more of fiber diet, along with the combination of other things. So ultimately, we are not undernourished. So all these factors in combination play a role. Ultimately, we should avoid addictions and try to stay as healthy as possible, and that is good for one's breast to avoid the breast cancer.
You said it right. So, a healthy diet and a healthy life is always recommended to avoid breast cancer or any other thing possible. Moving on to my next question with Dr. Adil. So, how do family history of genetic mutations contribute to the risk of breast cancer? And how important is genetic counseling for those with a strong family history of this?
I think you raised a very important question. See, it is important for us to understand, family history. Although it is important, it is not the only thing. Probably we see, out of 100 cases, if we see of breast cancer, probably 5 or 10, at the max 10 cases are having a very strong family history. So just because you're having a family history doesn't mean that you should compulsorily get breast cancer. That's the one misconception that is there. And the second misconception that we see is, if you're not having any family history, you should not get breast cancer at all. So that is the other spectrum. So now, see, when should we suspect that there's a genetic, factor which is affected? Is, let's assume that if there are multiple members of the same family which are affected, like I said earlier also. Suppose if the same individual, say, has one type of cancer, like ovarian cancer, and having the breast cancer. Suppose they had breast cancer on one side, then they have the breast cancer on the other side. In such patients, we can do something called genetic testing, basically. And again, even if you do the genetic testing and if something comes positive, then of course we need to counsel the other relatives as well. That you'll have to discuss with your oncologist in detail. So to long story short, there are only a select group of patients that we do this special test. Maybe at the max 5 to 10% of the population, breast cancer population.
Thank you so much, Dr. Adil, for explaining that to us and how this mutation or genetic factors affect this. With my next question to Dr. Chandralekha, ma'am, what role does hormonal replacement therapy, that is HRT, play in increasing breast cancer risk, and what should women know before considering HRT?
HRT is mostly common in UK, USA, and such type of countries, and yeah, maybe in higher class families also they are been taking it. Where it is used, they are used for postmenopausal women to prevent the vasomotor symptoms or the vaginal dryness, to prevent the bone loss. For these kind of reasons, usually the postmenopausal women take these tablets. So they are of 2-3 types. It may be actually the estrogen level declines after the menopause. So just to alleviate the effects of estrogen, they are supplementing with that. So it can be only estrogen only pills or combined with the progesterone also. So there are many studies which have looked forward towards this, whether the hormone replacement therapy is really causing breast cancer. Yes, it does, but we should know on what context this does. So when the women is taking for more than maybe 1 to 5 years, the risk of cancer incidence increases. That may not happen immediately. It can happen even after 5 years, 10 years, or even up to 15 years. The chance is slightly increased from a normal woman, but it is not too high, but there is risk. And when we come to the type of the tablet, estrogen containing pills and combined pills, there are risk in that, but little higher in the combined pills. So a women must be aware of the future incidence of breast cancer also before taking this HRT tablet. The two things to keep in mind is that the duration of for which she is taking, it should be a long duration, and the risk can be there even after 10 years also. So they can there are alternatives for taking this for the purpose, for what purpose they are taking this hormone replacement therapy. There are they have experienced the postmenopausal symptoms. So for alleviating those symptoms, there are alternative drugs also which are available, which can be prescribed by gynecologists to alleviate the symptoms that are temporary for her. So there's an alternative for that also.
Just a follow-up question on that, and to be clear around HRT, is this HRT a volunteer where patient comes and ask for all such treatment and therapies or the replacement drugs for all those symptoms, or maybe just to avoid the postmenopausal symptoms, doctor recommends some such kind of medicines?
It can happen either way. It can happen either way, but mostly it is prescribed by a gynecologist. And nowadays, the women are itself aware that taking these drugs can alleviate those symptoms. So some people may voluntarily ask also. Some educated women may ask about it, but the gynecologist who is prescribing that should explain the late toxicity of these medicines also, and just keep a word of caution to them.
Okay. Thank you so much, ma'am, for explaining that to us in a very simple language so that everyone knows what exactly is HRT and how it affects, what are the side effects or the future incidents could raise the risk of having breast cancer. My next question is to Dr. Shruti. Ma'am, are there any environmental or workplace factors that are linked to an increased risk of breast cancer? Because nowadays, with the pollution and these festivities, everything has increased. So does all those things play a factor in increasing breast cancer risk?
Definitely, there are risk factors which would increase
Ma'am, we cannot hear you.
risk
You're
of.
stuck. Yes, yes. Now we
Okay,
can hear
okay,
you.
now you
Yes,
can hear
yes,
me.
yes,
Yeah.
ma'am.
So yes, therefore there are factors which can increase the risk for women occupationally. There are much more studies which are going, and we need little more promising data. But the ones which are assumed, or they are I would say which are known to cause, would be ionizing radiation, where there is excess of exposure to scans, unnecessary scans, maybe one of those. Then workplace things like night shift workers, because of change in circadian rhythm and melatonin, is known to cause higher risk of breast cancer. There is data to back that. Then there are some chemicals which are known, people working, or women working basically in factories where they are exposed to pesticides, insecticides, such chemicals, or any endocrine expressing chemicals, or changing chemicals, are also known to increase the risk of breast cancer. We all know about some products that you get in the market, parabens and BPAs, which are known to increase kind of breast cancers. So I think so these are some things which are still evolving. We need more data around it, but it's always better to avoid such situations.
Thank you, ma'am, for giving us all those examples which actually which are contributing for the risk of breast cancer. As we all discussed about the risk factors and the preventions, how can we prevent breast cancer? Now we'll be focusing more on the treatment options and the innovations. Starting with Dr. Arun. So, what are some of the most exciting recent advancements in breast cancer treatment and how they have changed the prognosis of patients?
I think rather than going to the medicines, I think it's a multidisciplinary form of treatment, which has become very acceptable now. Because previously, somebody with a breast lump will go to surgeon, operate, and that's all. But nowadays it's changing. There's a team of doctors in almost all the hospital, be it private or public sector. There's an oncology team is there, where the patient can meet the medical surgeon and the radiation doctors, and there's a that I think that has really changed the way we are able to treat the disease. And I'm not going to details, so there are a lot of newer medicines which are coming in. I think the other speakers, other panelists will talk about that. But then, and the accessibility has also increased a lot. Even in a country like India, we are seeing newer cancers, and a lot of newer cancer centers coming up, and there is clinical trials are happening here. So, and accessibility of the drugs have improved because of the price control and all. So, this comprehensive cancer care, the affordability, and the accessibility to a larger section of the society. I think these are very exciting, which I've seen in the maybe last 10 years in cancer care.
Thanks a lot, sir, for focusing on more of the recent advancements and the innovation that has helped to in the better treatment for breast cancer. Now, focusing more on the treatment options, Dr. Mridul, how is immunotherapy being used in breast cancer treatment, and what makes a patient a good candidate for this approach?
So basically, immunotherapy it can be used if the breast cancer is localized, or even it is spread to the other parts of the body. And the candidates are the patients who are triple negative breast cancer. Triple negative breast cancer is a subtype which does not express either hormone receptors or HER2/neu. These are the important receptors which can be targeted with the certain medications, with the anti-hormonal medications or anti-HER2 new medications. If both these receptors are negative, the patient is called triple negative. And in this subset of patients, basically, these are the patients who are the candidates, whether the disease is localized to the breast or whether the disease is spread to the other parts of the body. In the advanced case, we also check for the PDL1, and if it is above a certain cutoff, we basically offer the immunotherapy to such patients. It's more beneficial in those, but again, the approval is across all subgroups. So that's a very specific answer to your question of immunotherapy.
Thanks a lot, sir, for focusing on immunotherapy and who all, is the best candidate or the best patient, which will actually work on them. Now, talking about personalized medicine, Dr. Adil, personalized medicine is the new buzzword, or I should say, is becoming a key focus in cancer treatment. So, can you explain how this approach benefits breast cancer patients?
You see, whenever we are dealing with any cancer of the breast, okay, so we are actually looking at two things. One, we are looking at the patient-related factors, and we are looking at the tumor-related factors. So we don't give every patient the same treatment. Obviously, how I treat a 40-year-old will be different from how I treat a 80-year-old. We need to see if the patient is having diabetes, hypertension, whether the heart functions are okay, kidney functions are okay, liver functions are okay. So all these things we need to see what is the stage of the disease. Stage 1, stage 2 obviously will be treated way differently when compared to stage 4. So all of these things are, the things that we need to look into. And if we look into the technical things, that is into the tumor, there are of course, certain things that we do. When we do a biopsy, we do certain tests under the microscope called immunohistochemistry. There we look for something called hormone receptors, HER2 receptors, Ki67. So there are certain things that we look for. And also nowadays, we have something called the genetic testing also. So we have, as of today, we have very good treatments available. So we have something like a targeted therapy in the form of anti-HER2 therapy. Earlier we used to have something called trastuzumab. Now we have the combination therapy, antibody drug therapy. You did mention about immunotherapy as well. So also there are some specific, even for patients who have some genetic mutation positive, like BRCA1 and BRCA2 mutation positive. For those patients also we have a lot of new drugs which are like available. So what I would say, in today's day, we have like a lot of new treatments available for breast cancer. It is not the same which was maybe 10, 20 years back. And that's the thing. We don't treat all of the breast cancer patients in the same way. We do some testing on the sample, and also we look at the patient characteristics as well before we judge what treatment to give. So that's essentially your personalized therapy. What you would say.
I think all because of the medical advancements, clinical trials, and the research work has helped us
Yeah.
out move
Yes.
to a personalized medicine and this genetic testing and all such things which actually targets on the disease which will affect the patient. Like you
Yeah.
said, you look for two things: tumors and then the patient. So
Yes.
and consider all the factors that is there and affecting the body, not just the tumor case.
Yes.
So yes, thank you so much for clearing this out and explaining us to all our audience about this. My next question to Dr. Chandralekha. Ma'am, what are some of the common side effects associated with breast cancer treatments, and what can be done to help patient manage them effectively?
So breast cancer, as already explained, it is a multimodality management comprising of surgery, chemotherapy, and radiation therapy. So the side effects or the post-treatment effects, toxicity are different pertaining to each of the treatment modality. So let me start with the chemotherapy first. So chemotherapy, as everyone knows, the basic thing is the first thing the patient is worried about or she wants to know is that whether the hair fall would be there or not. Because for a woman, based on the social stigma, this is very much more important for the patient. And our breast cancer chemotherapy main drugs definitely cause alopecia. Total alopecia is one of the major side effects, and it is really inevitable. So
Ma'am, we cannot hear you. Dr. Chandralekha, we cannot hear you. We can see you, but we can't hear you, ma'am.
You are able to
Yes.
hear me?
Yes, ma'am. Yes,
Okay.
ma'am. Now I can.
So the only thing, yeah, only thing we can do is that we give a social support, ask the relatives give a moral support, and wig is available, but that is just an option. The other important side effect which the patient needs to know is that generalized fatigue, nausea, vomiting, and decrease in the blood counts, which is most common side effects. So for this nausea and vomiting, we have really new drugs which can help prevent these things. But fatigue is being inevitable, and most of the patients, even with adequate medication, they definitely experience fatigue at least for a period of time, initial period of time, and after that they will be okay. And for prevention of decrease in counts or the WBC, also we have adequate medications as of now. And even if the patient presents to us with low counts, we have adequate medication, but they should be kept on a they should be told a word of caution about these alarming symptoms, whether fever or loose motion or whatever may be persisting for a certain period of time. They should report to the doctor immediately. That word of caution should be told to the patient. This is pertaining to the initial adjuvant chemotherapy, which is given routinely with the for the breast cancer. So surgery is a single day procedure, and mostly they are discharged after 2 days. And most common is that they experience a lymph edema, that may be a later side effects, or just like any other wound, they're experiencing quick recovery from that surgery. Regarding the radiation therapy is also the toxicity side effects are temporary only. So during that time, they will be experiencing that darkening of the skin or peeling of the skin. Apart from that, there is long-term toxicities of lung being affected or heart being affected, but that is really very minimal as of nowadays. With the advancement in radiation techniques, that is really taken care of. So the patient need not bother about that actually. So these are the different treatment side effects which the patient may experience during the treatment.
That's great, ma'am. Because of the new technologies and advancements, the therapies are itself taking care of that. There's no much side effects, and even if there is, there's way out, solution out, and doctors, counselors, family, friends, and everyone is there to help them out. I think that's how we are moving forward with the help of innovations and our great team of researchers and doctors who are taking care of all our patients, not just for the treatment but the post treatment as well. So now, as we discussed about the treatment aspect, moving forward, we'll be talking about the post-treatment care and survivorship. My question is to Dr. Shruti. Ma'am, what are the primary challenges that breast cancer survivors faced after completing treatment, and how can they best navigate life post-recovery?
So, definitely having a diagnosis of breast cancer, going through the treatment is already having a profound effect on the patient as well as the caregivers. And post treatment, I think so, everyone has that question, will it ever come back? Like the big question, which I think so, no one can answer for them, not their doctors, not them. So, surveillance of follow ups is something which is very important, which has to be holistic, which has to be very realistic depending on what was their initial stage. First 2 years are very crucial. Meeting your doctor very frequently, once in 3 months, is what is really recommended, and getting yourself checked. When that checkup, when the patients come for that checkup, it's very important to discuss with the patient to normalize their life. Similar support should be given to the caregivers because they've been through a lot. So I think so it's very important that everything is approached, for them getting back to their normal life in terms of job, family life, friends, moving out after all these side effects, hair loss, dealing with these things. So there is a lot that needs to be discussed at that point of time with the patient, and it should be a very open and frank discussion. Similarly, during follow-ups, caregivers should also be given realistic, what are we actually aiming at? And I think so beyond 2 years, then we can relax to 6 years, 6 months follow up for the next 3 years, and after 5 years, I think so. Um, we can beat them once a year, though that lifelong risk or that thing is always there. But I think so. Being more positive and giving hope is what is really required for the patients.
Thank you, Dr. Shruti. And I think you said it right. There's this always the risk of relapse of cancer, and no one can actually assure that whether it will come or not. Only the surveillance is the way to move forward and the follow-ups. So, with my next question to Dr. Arun. So, as you discussed about the surveillance and the post, we are discussing about the recovery of from cancer. So, how important is follow-up care and monitoring for breast cancer survivors? And what should they be aware to prevent reoccurrence?
Yeah, I think the monitoring pattern Dr. Shruti has already told. So basically anything which is abnormal, that's what, because everyone is worried about a relapse. So even if you do a mammogram 1 month back, but a new lump has come up, so that again has to be taken care seriously. So it is not that if you do a scan once a year everything is fine. Some people have that misconception also. So we have to tell them that anything which is abnormal, which is lasting for more than 2 weeks, and again, people ask us what is the sign of a relapse. So there is nothing that we can pinpoint like that. It all depends on which part can be affected. Like it can be body pains, it can be cough, breathing difficulty, fever, weight loss. So the problem is that the recurrences really cannot be predicted based on symptoms. So what we tell our patients, any small issues or anything you feel abnormal, be it a physician, he will do the basic test. If it is not coming down within maybe 2 weeks time, then we have to think of a possibility of a relapse or a recurrence of the disease also. So that is how it is important, and they have to be, like we told, like a prevention aspect that has to be continued for a lifetime. So they have to cut down, they have to maintain a healthy life. All this will help, because again there are some long-term side effects of chemotherapy and all, which again can be reduced if they follow correct medications for whatever lifestyle disease they have, and also go for the preventive checkups and all. So it's a once you are affected with cancer, it's a lifelong that is there, but it's not a threat. I feel it's an opportunity to be more aware and to be proactive in managing a healthy lifestyle.
You pointed out a very good point, sir. You have to be. It's something good that you are vigilant about your health. Even if you are so aware that for regular checkups or for any small thing, you are aware and you know where should you go, and you should not waste time on that. As we just talk about the follow-ups and the reoccurrence, I have a question from the audience, that is monitoring after breast cancer every 6 months is important. Which test should be performed regularly for this?
Yeah.
Dr. Arun?
So basically, there is there's a pattern with Dr. Shruti was telling, initially 3 months, 6 months, like that. So after 5 years, it's community follow up. So there is no single test that we have to do. It's annual investigations which we do, like mammogram, ultrasound, and X-ray. So maybe after 5 years, you need not be an oncologist also. Just do the regular health checkups every year. So that is how we have to follow them.
Thank you so much, sir, answering to our audience about their questions. My next question is to Dr. Mridul. So, how does reconstructive surgery impact the physical and emotional recovery of breast cancer patients? And how should patient approach this decision?
So, thank you for that question. First of all, definitely we have plenty of patients who go ahead with this surgery. And basically, the thing is, whenever the patient undergoes surgery, and if there is a loss of body image, that in itself is a kind of trauma, a psychological trauma to the lady. So the reconstructive surgeries thereby have a great role to play, and whenever possible the reconstructive surgeries are encouraged. Obviously you have to see whether the patient needs immediately radiotherapy, or basically that thing is not required. Basically we have the clinicians have to decide whether immediate reconstructive surgery is required or later on it has to be taken up. That is a clinical decision, but otherwise I think it should be encouraged. And if it matters to the patient a lot, then probably it should be followed more aggressively. But if it does not matter, and there are certain patients who don't worry, maybe the elderly ladies after 70s or 80s, then probably we can just let it be and go ahead with the standard surgery of removing the cancer and the lymph nodes.
Thank you so much, Dr. Mridul, for answering my question. Moving on to my next question to Dr. Adil. So, what more can be done to raise awareness about male breast cancer, and how can men become more active allies in this fight? Because not females are not the only one who's under the target of breast cancer. Now, according to WHO, male breast cancer is also there. The percentage is very less, around 1% or somewhere around this. I'm not sure about the exact statistics, but how can we raise awareness and prevent male breast cancer as well?
See, like you rightly mentioned, the incidence of male cancer is quite rare. Like you said, it's around 1%. Like similarly, how you are trying to raise awareness among the ladies in terms of their examination. We also need to address the general population in forums like yours, that even for males, it is possible to get breast cancer. Just because so you generally tend to assume that breast cancer can happen only in females, or even if some sort of swelling happens there, probably they'll tend to think probably it is nothing, it can't happen to me. So that sort of awareness has to be created. I think that's the first step. So having these education programs and forums like yours to raise the fact that it is possible, and in case if you're having such symptoms, please come and visit your doctor. I think that is the first step that we need to do.
So, does the family history of having breast cancer to a female can
Yes.
affect that to a male also for breast cancer?
Yes, so there is these genes called BRCA1 and BRCA2 gene in particular. So that if it is inherited from say a mother to a son, then that particular individual will have a higher incidence of types of cancers like prostate cancer, pancreatic cancer, and breast cancer also. So especially in families who have a history of cancers, in that particular subset, suppose if there is a genetic mutation positive, in if you have found it out in the genetic screening, then especially those members of the family should be especially counseled. I would say. I think you had a fantastic follow-up question.
Thank you so much, sir, for answering that question and creating that awareness on male breast cancer as well. Because, like you said, there's this misconception breast cancer can only happen to women, but there is this proper statistics, and the doctors also recommend and have put in their words out that it can also be caused to males also. So, not just the females, but males has to be also similarly privileged, vigilant about their health and should take care of their health. Moving on to Dr. Chandralekha. Ma'am, how can the healthcare system provide better long-term support for breast cancer survivors to help them lead healthier, more fulfilling lives after treatment? Dr. Chandralekha? I think she is not here. Just a second. Ma'am, can you hear us?
Yeah, I'm here. I just want to repeat the question.
Sure, ma'am. I'll do that. Ma'am, how can the healthcare system provide better long-term support for breast cancer survivors to help them lead healthier, more fulfilling lives even after their treatments?
You are asking regarding the diet, right?
No, ma'am. I'm asking about how can healthcare system provide better long-term support for breast cancer survivors to help them lead
Okay.
healthier and more fulfilling lives after treatment?
Okay. So this is basically after completion of treatment, entire treatment, the patient will be definitely in a chaotic situation or in a depression only, even after completion, or they might be very apprehensive or anxious also, whether it will come back. I think this is already discussed also. So the main thing is that we should counsel the patients and keep them on surveillance. I think ma'am has already told about surveillance. So surveillance during that same time when they come for the surveillance, support and the to the patient and the caregivers, and just to keep them on correct follow-up. So these are, I think these are very meticulous for the breast cancer survivors. And they can be asked to, in case they are doing a job, they can be asked to rejoin their job and go on and cope up with their normal active lives. But with a word of caution that they should be on a constant follow up. And so the balance should be kept between that they should be on a follow up at the same time to just forget their past treatment history and get back to their normal life. So that balance should be kept. So that lies in the doctor to explain to the patient in such a way that both the things are managed properly.
Thank you. Thank you so
And
much,
also
ma'am.
the caregivers should be lightened up about all the things, in the sense about the diet, healthcare practices, and being on constant follow-up, and giving support to the patient, moral support, and everything. The caregiver should equally be counseled upon.
You said it, ma'am. You said it right, ma'am. Without the guidance and the help of caregivers, that is our family, friends, and other medical, people associated with this, is incomplete, because their continuous guidance and care is important post treatment or post recovery as well. I would like to end this session and I would ask Dr. Arun to give us a closing remarks for this panel discussion as we are moving towards the end of this session. Dr. Arun?
Yeah. I'm audible. Yeah, it was muted. Yeah, fine. I think it was interesting. It was great to have views from experts about the various aspects. I am sure that the public would have got very positive messages, and there were also some guidelines. Also, we tried to discuss. One good thing was that even though we are all medical oncologists, we didn't talk much about treatment because that would have been very difficult. So the focus was really on the positive aspects of detecting early and to treat, and also to how to continue the follow up in a positive manner. So it was very good that you brought out such the questions was really to the point, and I think you got the messages from us in a good manner. So congrats to Ms. Chaudhary also for that. Thank you.
Thank you so much, sir. And thank you to all the panelists for coming to this platform, giving out your time to raising this awareness on such and crucial, important issues. With the help of this, great panel, the expertise of panel, we got such a different insights, and all the things were explained to our audience in a very layman language so that it is very easy for them to understand. And with the help of such panels, we intend to create awareness about breast cancer and eliminate hesitancy or fear that what if they got breast cancer, how will their life be after this or that, and all such myths around or the things in their head. So that's what we aim for with the help of the expert doctors with us, and those who agree to share their insights and expertise with us, because all your time efforts means a lot and matters a lot for us and to all our audience. So thank you so much for coming to this platform and sharing your time and expertise with us.
Thank you.
Thank you.
Thank you so much. Thank you so much.
Thanks a lot.
Thank you so much. Thank you.
Thank you.